All right, welcome everyone back to another virtual shadowing session at Hearts for Health. Today we are joined by Dr. Cyrus for another dental shadowing session. Today we're going to be talking about orthodontics. Dr. Cyrus himself is an orthodontist with training from one of the top orthodontic residency programs in the country, Eastman Dental Center at the University of Rochester. For a few reminders to those who are listening in, if you're new to virtual shadowing, we do have a few things that you might not be familiar with, so I wanted to shout them out for you. One being our Q&A session. So at the very end of each of these sessions, we have different speakers, different specialties, different fields. We'll have a Q&A. That Q&A might be 15 or 20 minutes, and you can ask questions through the chat box feature. If you write them or type them in the chat, I will read them out to our speakers, and we'll be able to go through your questions at the very end of this session. For those who want to stay updated with future shadowing sessions, we usually have a Monday and Thursday schedule. So you can stay tuned with us either over Instagram or over our email listserv. Both are places that we will submit and post flyers over not only shadowing, but also our other programs. We've introduced a few other programs this summer. But outside of that, that's really all. If you do have any questions or you want to be added to our listserv, feel free to go to the bottom of one of our pages on the website, enter your information in, your name, your email, click subscribe, and you'll be added onto the listserv. That's a weekly listserv on Tuesdays. Or if you want to, you can also just email us at shadowing.h, the letter 4, the number 4, h@gmail.com, and ask to be added again with your name and email address provided in your email. We'll be able to add you into the listserv. If you do have any questions, you can also contact the same email regarding anything to do with shadowing or Hearts for Health in general. But with those reminders out of the way, Dr. Cyrus, feel free to take it away.
Great, thank you. So I'm Dr. Cyrus. And I'm an orthodontist practicing in San Diego, California right now. So I'm just hoping to share a little bit about my experience, kind of what I do on a daily basis, and what does it mean to be an orthodontist? And I look forward to getting your questions at the end. So here we go. Okay, so to start, a little bit about me. So I am the oldest of 4. You can kind of see, I don't know if you guys can actually see my mouse. Can you see my mouse clicker on there? Okay, yeah. So I'm the oldest of 4. So these are my siblings, as well as my wife. So she's also an orthodontist. I think you guys will be hearing from her next week. But just a little bit about me. I was born in Maryland, raised there my whole life. I went to college as well as dental school in Maryland. And then I ended up going to Eastman in Rochester because it's one of the top programs in the country. That was kind of the first time I had moved out of the state. I knew I wanted to be an orthodontist since I was in high school, actually kind of going through my own treatment as well as, shadowing and volunteering when I was in high school and college at my own orthodontist office. I ended up going straight through school, so I didn't take any breaks. From high school to college to dental school to specialty residency and now straight into work. I met the love of my life in residency, Dr. Nilab Anwar right here and there and there. So she's actually from San Diego, so that's kind of why we moved back out here. But you can kind of see a couple of our favorite spots in San Diego, right by Torrey Pines. We enjoy going hiking on the beach and everything like that. So just a little bit about me. So kind of going into it, I'm not sure where most of you are at in terms of your, education and everything like that, but college is kind of where things start to get serious if you're interested in becoming an orthodontist or even going just to dental school. So in college, I studied bioengineering at the University of Maryland, as well as I was in the Scholars Program for Science and Technology. That was kind of one of those optional programs, but I did it to help boost my resume and also help with my science courses. In terms of college, that's really where you're going to start on your dental journey. It's really important to be involved in different organizations as well as leadership roles. So I was in the pre-dental society since my first year in college. And, over the years, I ended up graduating into higher positions. So first I was treasurer, then I was vice president, and so on and so forth. I did a lot of volunteering while I was in college as well. I would volunteer as a tutor, for middle school kids. I would go volunteer at homeless shelters. These are all types of important things to do, not only to give back, but it will also help your resume as well. And any dental school will want to see that you're actively involved in your community. You know, I also did a lot of shadowing. I know that's been tougher for you guys, because of COVID and everything like that. But shadowing is an extremely important component of applying to either medical school or dental school, mainly because they want to make sure you really understand what you're getting yourself into. I mean, it was a long journey. It was 4 years of college, 4 years of dental school, and then 2 years of specialty training. So when you add that all together, it was 10 years of schooling, all to get to one spot. And so they want to make sure that you really understand what you're getting into and that you're in it for the long haul. You can kind of see what my overall GPA and my science GPA were, as well as my DAT score. So for those of you guys who don't know, the DAT is the dental admissions test. So this is kind of like the MCAT for medical school. It's something that you have to score very well on in order to get into dental school. And obviously the higher you score, you'll be eligible for scholarships and get into your top choice of programs. Okay, so then fast forward. So I went to University of Maryland, graduated there. I was fortunate enough to be accepted right into the University of Maryland Dental School in Baltimore, which is an excellent school. There I studied really, really hard. It was a lot of sacrifice. And I ended up graduating towards the top of my class. So I had 3.9 GPA and a high class ranking. These are all things that are really important if you want to do orthodontics. Orthodontics is an amazing profession, and I'll kind of get into that a little bit more later. But, for those of you who are serious about orthodontics, you need to be at like the top of your class, because everybody wants to do orthodontics when you're in dental school. So they only typically accept like the top few students. In addition to, studying hard and obviously doing well in school, I did a lot of shadowing experience even when I was in dental school. I would go to private practices of orthodontists that I knew or met when I was kind of networking. And I would kind of just go see what they do day to day. Orthodontics is a really unique profession. No two offices are the same. No two orthodontists are the same. There's a lot of different ways to do things, which is one thing that I really love about it. And it makes it always fun and interesting and unique. In addition to that, I also spent a lot of time in the University of Maryland dental orthodontics clinic, kind of shadowing the residents as well as the faculty members there. I think that's a great way to kind of like see if you like orthodontics, but in addition to that, get to know the faculty and residents, because they end up having a lot of say in terms of who gets accepted to their programs. And typically most orthodontic programs only accept like 4 to 6 students. So it can be extremely competitive. In addition to, doing more community service, which is extremely important. I was also in the orthodontic interest group, which is kind of like the pre-dental society essentially, but for those who want to become an orthodontist in dental school. And so same thing, I was treasurer and I kind of worked my way up. That's kind of what you need to do if you kind of want to get ahead. The way it works if you want to do orthodontics is during your 3rd year of dental school, you start getting your letters of recommendation. You have to take the GRE, which is just another one of those exams that they want to see that you can score well on. And then you actually apply during your 3rd year, and then you go on interviews during your 4th year. And then in case I didn't mention that before, that's the same way dental school would be as well. College would be as well, applying to dental school. So when you want to apply to dental school, you'll actually do most of like your DAT and test taking in your 3rd year of college. And then you'll apply at the end of your 3rd year during that transition summer between 3rd and 4th year of college. And from that point, you'll typically go on interviews in the fall and winter of your 4th year. So fast forward, I was really, really fortunate to be accepted into like my top choice in Rochester, University of Rochester, Eastman Institute for Oral Health. So that's actually where my own orthodontist went, the one who kind of inspired me to be an orthodontist. And so he highly recommended it. And in addition to the fact that, it's a great program, you learn a lot there. They also do pay you, which is really nice. Most orthodontic residencies, they charge anywhere from $70,000 to $100,000 a year in tuition. Eastman doesn't charge you any tuition, and they actually pay you a small salary just to kind of pay for your living expenses, rent, things like that, so you can live comfortably. So that's definitely one of the reasons it's more competitive to get into, is because everybody would rather not have to pay tuition if they had a choice. Following orthodontics residency, I did do board exams and certifications, so I'm currently board certified. And in residency, we had a ton of clinical experience. One of the things that really drew me to Eastman, that makes it such a top-notch program, is that we get to treat a lot of cases and we get to learn a lot of private practice experience. So that being said, when I graduated from Eastman, I felt ready to go right into private practice and be able to handle that caseload. Because when you're in residency, you might see like 6 to 12 patients a day. And when you get into private practice, depending on how busy an orthodontics office is, you might see anywhere from 60 to 100 patients a day. So it's a big step up, but going to a really strong program like Eastman with a heavy clinical focus helped me prepare for that. So I felt very good and very comfortable and confident with that transition. I did do a research project at Eastman. That was more on the engineering side of things with my background. And it was on basically different types of plastic materials and how they perform under different heats and temperatures and pressures. The most important thing about residency, though, was that I met my wife. So she's also an orthodontist. She's awesome. You guys will love her. And so that's kind of where we went into. One of the most important things is kind of like, what is an orthodontist? What is it that we do? And I think the easiest way to kind of break it down is that, most people think of it as, okay, we do braces or we do aligners like Invisalign. And that's true. That is kind of what we do on a daily basis, but it goes a little bit deeper than that. So really, at the end of the day, what we're doing is we're diagnosing and treating many different types of what we call malocclusions. And what a malocclusion just means is a fancy word for a bad bite or a misalignment. But in addition to like correcting bites and lining things up and making things straight, we can do a lot to give people a beautiful smile and that confidence that they want that comes with having a great smile. And that's why this profession is so rewarding. We get to change people's lives every day. And it's one of those professions where, people typically aren't afraid to come see you. There's a lot of stigma around going to the dentist and people being afraid of getting a filling or a shot or a cavity. Even, kids going to the doctor, they're always nervous because they're going to get a shot. So typically as an orthodontist, we rarely, if ever, give any shots. We don't do anything that would be super uncomfortable. With braces, we do have to do some tightenings, and your teeth are sore for a day or two. But, overall, there's nothing too traumatic or too bad that we do. So most of the time, it's a very fun atmosphere, a fun environment to work in. And if you're doing a lot of the aligners, which is over here on the right, similar to the Invisalign, then it's even better, even more comfortable for the patients because we don't have to do those tightenings. So kind of going into the real world, right after I graduated from residency, obviously I had to find a job. So me and my wife ended up working in Buffalo, New York for 2 years. We had an amazing opportunity there. There was a large pediatric dental group. And so we ended up working for them as their orthodontic team, which was really fun because, we got to work together as husband and wife. And, we got to spend a lot of time collaborating together, learning together. In addition to that, because it was a pediatric dental group, they didn't really know much about orthodontics, at least the business of orthodontics. And I have some background in that. So I actually got to kind of run their practice for them on the orthodontic side of things, which was also a great experience for me, being able to kind of like get used to doing that. So that way, when I opened my own practice, I already had a lot of that experience under my belt. In addition to having our own office, that we opened. We also do work part-time in different corporate offices. As you can imagine, it's very slow when you first start your own business. It takes time to grow. And so in addition to kind of like cover the other time where we're not working in our office, we work at other corporate offices. And all of that's in Southern California. And we both live in San Diego. So the typical day for an orthodontist, one of the nice things about being an orthodontist is you have a lot of flexibility. So I know some orthodontists who only work 2 days a week. I know some that work 6 days a week. Most orthodontists are working about 4, maybe 5 days a week if they want to stay really busy. And the hours are typically 8 to 5 or sometimes 9 to 6, depending on which office you're in. We do a lot of consultations, so it's a lot of talking. You gotta see a lot of patients. Most offices are seeing like 60 to 80 patients a day. Sorry. And so then when you're going into your consultations, this is kind of where a lot of the thinking is going on. So you meet a patient for the first time, you have to figure out what their problems are, you do a good diagnosis, and you have to come up with a treatment plan. It's kind of like almost playing a game of chess. You have to kind of think ahead a few moves, and you need to kind of understand exactly, how am I going to get to the end result that I want, and what steps need to be taken. So it's a lot of thinking, and that's why I love the profession so much, is that it's really heavy on the thinking and problem solving, and each patient is different, so it's almost like a puzzle. So I just find it interesting, and it never gets boring. In addition to the consultations where we're doing most of the diagnosing and treatment planning, we also have a bunch of different appointments, such as adjustments, where we kind of tighten the braces. We also do bondings where we put the braces on, debondings where we take the braces off. In our office, we do a lot of aligners, which most people know as Invisalign. And so for that, we do aligner deliveries, we do retainer checks, aligner checks, and then occasionally we have emergencies as well. That's one of the other real benefits of our profession as an orthodontist, is there typically aren't any real emergencies. It's not like being like a medical physician where you're on call and you have to be going into the hospital late at night or anything like that. Typically in orthodontics, we don't really have any emergencies, other than maybe like a poking wire or something. And those are typically a quick fix. We can clip the wire in under 10 seconds and get the patient comfortable. Now in our office, we do a lot of aligners, which I'll go into. With aligners, you really don't have any emergencies. So it kind of gets rid of that entire component, which is another benefit. So something I think is important, it's not really talked about enough, is kind of what is salary and compensation. And, this is kind of important when you're considering a career, and it's definitely not all about the money, but you should know at least, kind of what you're investing in, especially if you're going to be going to dental school for 4 years and then orthodontics residency for 2 to 3 years. Sometimes I know orthodontists who graduate with almost $1 million in loans. And so, you have to think about, how am I going to realistically pay that back? So typical pay for an orthodontist, and obviously this varies depending on where you practice and where you live. So if you're in a more rural area, you're going to get paid on the higher end of things. If you're in a big city like LA or New York or around San Diego, like where we are, you're going to get paid a little bit lower, and that just has to do with supply and demand. More orthodontists want to live there, so there's more competition. The salary is going to be a little bit lower. Vice versa, if you're going out into the middle of a rural community where you're the only orthodontist in town, you're obviously going to get paid a little bit more. That being said, if you're an associate working in a private office, you typically get paid around $1,000 to $1,200 a day, depending on how many days a week you work. And again, this is very flexible. It's really up to you as an orthodontist. If you want to work 2 days, 3 days, 4 days, 5 days, the more days you work, obviously, the more money you make. But that being said, you also want to enjoy your life. One of the nicest things about orthodontics is you can have a lot of flexibility. It's great, especially if people want to like raise a family. I know at some point my wife will probably only want to work like 2 or 3 days a week so she can spend more time with our kids. And that's one of the beauties of orthodontics, is you have a lot of work-life balance and flexibility there. So typically for a private practice, where you're kind of working in an already established orthodontics office that's already doing very well, it's a little bit easier job, but you get paid a little bit less. So that's around $1,000 to $1,200 a day. When you're working in a corporate office, you typically get paid more, but you're also much busier and you might not have as much guidance in those areas. You're kind of on your own, essentially. So that can be anywhere from $1,200 to $1,800 a day. Now, where you really do well is if you own your own office. And this is obviously after you've kind of had your own office for a few years. But after having your own office open for about 5 to 10 years or so, you can potentially make up to $1 million or $2.5 million a year in that office. Now, you don't get to keep all of that. Obviously, you have to pay taxes and you have expenses. You have to pay for your employees, insurance, all the materials and everything like that, but you still do very well. It's just a matter of finding what you like. And that's one of the beauty, again, of orthodontics is there's so much flexibility. There's so many different paths you can take. There's some people who don't want to own and run a business. And for them, just being an associate in a corporate office where everything's taken care of for them, all they have to do is show up and do the orthodontics, treat the patients and go home and not worry about anything, then that's a great option. But for those people who want to own their own business and, be constantly working on it and improving it, it's a full-time job. It's a 24/7 job, owning your own business, but you can also make a lot more money that way. And then there are some also, faculty and obviously teaching positions. Those typically tend to pay lower than the other three above there, but it tends to be a little bit more relaxing environment. And for those who love to teach, it's an awesome option as well. So one thing that I'm really big on personally is technology. I think it comes from my background in engineering, but I've always been fascinated with technology. I'm like a computer nerd and everything like that. So anytime new technology is coming out, I try to stay on the forefront of that. Me and my wife, we do a ton of CE, which is like continuing education. We go to a lot of courses and just try to stay up to date with the latest technology and materials and everything that's on the cutting edge. So I just included a couple things on here that are kind of newer technologies that have come out, and I'll kind of go a little bit into each of them. But over here, if you can kind of see my mouse, so this is a 3D scanner. So, long gone are the days of, having to take those goopy molds and impressions. Nowadays we can take a 3D scan. It's way more accurate. It's way more comfortable for the patients. I myself am a gagger. So, anytime they had to take the impressions, I thought I was going to throw up. It was really uncomfortable. With this, we really don't have any of those issues. And not to mention the fact that it's all digital, so it's cleaner, it's not as messy. It can be uploaded to the cloud, so you don't have to store a bunch of items. It also can be sent over the internet. So, when we do a liner treatment, which you can kind of see right here, so Spark aligners, so that's a newer technology. So Invisalign is kind of what most people know, just because they were like the first aligner company on the market. And they're good and everything like that. But Spark is a newer technology, newer aligner system that I've found works a little bit better over the years, kind of trying both out. But for Spark, what we do is we actually take a scan, we send that over the computer, and then Spark can actually make the aligners without us having to take a mold and physically mail it to them. So it's much more efficient communication, as well as accuracy as well. And then over here, we have a 3D printer. So this is our Sprint Ray Pro. And so one of the nice things is any of these clear aligners, similar to the Invisalign, those are all made from 3D printing. And so now that 3D printers have become more affordable, we can actually do some of this in our own office. And you can kind of see down here, this is kind of what it looks like. So we would 3D print the model of the teeth, and then we can kind of make a little clear retainer that would move the teeth over time. Okay. So really, where the future of orthodontics is headed is increased technology, more digital workflows and solutions. Think aligners. That is, if you give somebody a choice, would you rather have braces or would you rather have the aligners? Almost everybody's going to pick aligners because it's more cosmetic. It's typically a little bit more comfortable. You can take them in and out. It's easier to brush and floss. The trick with aligners, you have to wear them obviously responsibly. If you don't wear them the 21 hours a day, they're not going to work very well. That being said, the aligners are a fantastic option for patients. And, with how far technology has come since Invisalign first came out 20 years ago, we can treat almost any patient with aligners. don't think I ever have to turn away a patient and say, oh, you can't do aligners, you have to do braces, unless they're just not willing to wear the aligners, in which case braces is the better option for sure. That's something that my wife and I focus heavily on is, technology and being able to be advanced aligner specialists, essentially. And there is more do-it-yourself companies. Smile Direct Club is a big one that I'm sure everyone has heard of. And so the idea with Smile Direct Club is basically like, you don't have to see a doctor, essentially. They'll just go ahead, you take the molds yourself, mail those in, and then they will just make the aligners for you and mail them back to you. So it's very nice in a way because you don't have to go into the office, you don't have to take time off of school or work or anything like that. And some people it's tough for them. That being said, there's a lot of issues with that treatment, which I won't be able to go into all of them now. But the main thing is you don't really have much supervision, and it's difficult when you don't have a doctor kind of monitoring things and being able to adjust on the fly. So, in orthodontics, if I'm seeing a patient regularly and I see that something's kind of like not working out properly or something's going off course, I know how to correct that. I know how to kind of intervene and kind of get us back on track. With these types of treatments, you don't have as much of that, essentially. And one of the big things about the future of orthodontics is being able to set yourself apart. So that's kind of why me and my wife, we both focus on aligner treatment, is because that's kind of where the market is shifting. Patients want that, and we want to be able to provide that service for them and that option for them if that's what they would like. So kind of going back through the digital workflow. So with aligners, and I'm going to walk through the whole process for it since that's kind of what we specialize in. The first step is getting a 3D scan. So this is our Prime Scan scanner here. So we get the scan here that goes over to Spark. They will actually custom 3D print all of the aligners using 3D printers here. And then we obviously have to take x-rays to diagnose and make sure there's no, gum health or tooth health issues. That going back, that's another issue here with the do-it-yourself companies. Is that there's really no doctor taking x-rays anytime you do that, because you're not going into an office. You can't take x-rays at home. And so anytime you're doing any sort of treatment without taking x-rays, you don't really know what's going on underneath the gums. And sometimes there can be pathology there can be extra teeth there. The patient could have a gum health issue, in which case you could end up losing your teeth just by doing those types of treatments with no supervision. So kind of going forward, like I said before, this is what we really specialize in at our office is doing a lot of aligner treatment. And I kind of put this there so you guys can kind of see what it looks like. So this is typically what the aligners will look like. All right. You can take them in and out. So this is the top aligner and this is the bottom. They're very clear, very aesthetic. Over here is kind of a side-by-side between Spark and Invisalign. So you can kind of see Spark here is a little bit more clear than Invisalign. You see a little bit of this grainy stuff here. And that just comes down to how they 3D print the aligners. And it's Spark, because they 3D print at a thinner thickness level, it tends to be a little bit more accurate and get a little bit better results in my hands. So I got some videos here for you guys. Hopefully this works. Let's see if I can focus this. Okay, so this is kind of, I'm going to walk you through the steps if a patient wanted to get aligners. What is that involved with, coming into the orthodontics office? So the first step is they come in and they see us, okay? And from there, we kind of do that consultation. We talk with them about their issues. And then if they want to get started with treatment, the first step is the scan. So this is our scanner. And then here's Dr. Nee. She's getting her scan for her Spark treatment. So it's very quick and painless treatment. We basically just scan them. This scanner is very accurate. Let's see here. And you can see up here on the computer screen. So it's picking up all of the teeth in real time. There. So that was only about like 20 seconds, but they did almost her entire upper jaw in that amount of time. Typically, it takes about 30 to 60 seconds per jaw. But the nice thing is it's very comfortable. This scanner does about 60,000 images per second. So it's very fast, very efficient. And then the final result on the computer is this. So you can kind of see it has all of her teeth there. And this is what we actually ship out and send to Spark via the cloud. So then this is actually what comes back to us. So, we send that out to Spark. Spark sends us back a mock-up treatment plan. And then we go in and we can play with the software. We can move teeth around. You can see these little blue bumps here. So these are attachments. This is a very important part of aligner treatment. So attachments help the aligners kind of snap into place, and it helps them kind of guide the teeth with more difficult tooth movements, such as a rotation. So a rotated tooth is something that's not that difficult to treat with braces, but because aligners work differently than braces, we have to kind of do it in a different way, essentially. And it can still be done, but you just have to know what you're doing. And so putting the right attachments and planning the right movements will help the aligners treatments be more successful. So that's kind of what we do here on the computer. And we go through, we plan all the movements for each aligner. And I'll play this little video here. So this is kind of like what her tooth movements would be like. You can kind of see her back teeth here. We're trying to line those up a little bit better. And then we're also kind of shifting her midline here a little bit over to this side to get it more centered there. But basically, this is kind of what we do on the computer. So again, I'm a big computer nerd. I love doing this. It's a lot of fun. I get to basically, it's like playing a video game, but I get to move around the teeth. I get to make all the treatment plans. It's very cool. It's very accurate. And based on this plan, they will make all of the aligners. So if you kind of see, as the teeth are kind of gradually moving in little increments, each one of those is going to be a different aligner. So this whole video is about 40 aligners. So they're actually going to 3D print, label, and ship us the 40 aligners that we will then go ahead and prepare for my wife or any patient that we treat. So then after this, so this is kind of the first appointment, okay? So we do the scan. It typically takes about 4 weeks for them to custom make all of the aligners, okay? As you can kind of see here, she has a few boxes of aligners, and all of the aligners are numbered. So I'll play this video again. This is gonna kind of walk through all the steps from start to finish for that first appointment for a patient. Okay, so I'll kind of break that down because I know that went quickly. It doesn't actually happen that fast. We obviously sped things up, but all those that's literally every step that happens at the appointment. Okay. Oh, sorry. 1 second. Let me see if I can. Okay. Okay, so that first step right here. So this is filling the attachment template. So basically we take a tooth colored material, basically what you would get for a filling. If you had chipped your tooth or something, we fill that up here. And then that is built in so that we can put those onto the teeth in a nice, efficient manner. The next step is we have to clean her teeth. So in order to get the attachments to stick on the teeth, we have to clean them and do a lot of different steps, which is kind of what we're going to be going through here. So the first step is kind of cleaning. It's basically when you go to the dentist for your 6-month cleaning, they use that electric toothbrush. That's all we're doing right here. So just kind of cleaning that up a little bit. Okay. So here, what we're doing is we're adding like this soap material again to clean the teeth. So we need to have them perfectly clean and immaculate before we kind of put those materials on there. So we apply the soap, we let it sit there for a little bit, and then after that, we kind of rinse it off and dry the teeth. Oops, sorry. Okay. Okay, so here we're drying the teeth. Okay, so then we apply the primer. So this is kind of like the little tooth glue that we go ahead and apply to the teeth. Have to dry that a little bit. And then now we put the template in there, and then we're using, sorry. We put the template in there, and then we use this blue light, and the blue light polymerizes or what we call cures all of the glue. So basically the glue is soft and moldable. And then once we shine this light on there, it actually hardens and sticks to the teeth. Okay. So then we go ahead, take that off. Sorry about that, guys. Okay, so she has all of her attachments on there now. So we just have to seat the aligners. So we actually try them in. Okay, and that's pretty much it. So we give them the aligners. Typically with aligner treatment, we give them about 8 to 10 at a time, and they come back in about 8 to 10 weeks. So you actually change them each week. Each aligner does about 1/4 of a millimeter of tooth movement. So it's very gradual treatment, but that's also why it's a little bit more comfortable than when you're getting your braces tightened, essentially. That being said, the patients have to wear it very responsibly. If you're not wearing it around 21 hours a day, it's not going to move the teeth like it's intended. Okay, so that's definitely very, very important there. One thing I wanted to go over was like a short case with you guys. So this is a patient that's in treatment with us, just to kind of show you guys what aligners can do. And so this is kind of one of the patients that we really love, and her bite was kind of a little bit off. You'll kind of see in some of the photos, and it's cool to just see how things look on the computer and then how they turn out in real life, because sometimes when you get a plan on the computer, things don't always turn out exactly the way that you planned. That being said, if you do a good plan, most of the time they will with these aligners. So this is kind of where her teeth were starting off. You can kind of see there's a lot of misalignment here. And this tooth was actually really pushed back a lot. You couldn't even really see that tooth very well. So this was kind of the plan we came up with. You'll kind of see the teeth kind of change and like evolve over time with the different aligners here. So again, it's very gradual. Each little increment is only 1/4 of a millimeter. So you can kind of see the teeth are kind of moving little by little by little. Okay. And this was over around 26 aligners. So it was about like 6 to 7 months of treatment. But you can kind of see this is a drastic change from where she started, essentially. We'll kind of go through that again. And so this is kind of all of the planning that I'm doing on the computer. So I move the teeth, I set up the movements exactly how I know that they need to be done. Otherwise, the treatment just won't work very well. For example, this tooth right here, you can kind of see this tooth is very tucked back there. If I just try to push on that tooth, it's not going to go anywhere. One of the keys is that I actually have to make some space around the tooth to kind of reduce any friction before I move it forward. And you'll kind of see, if we go back here, so it's very tight right here. You're going to see some small little spaces open up there. See that little space? So I open up those spaces before I move the tooth, and I'm doing the same thing over here too. And this is just from experience, kind of knowing, how to do things. There's a lot of physics and biomechanics involved with orthodontics, being able to know how to move the teeth. Like, for example, I'm also using these second molars as anchors to help kind of push the rest of these teeth out. But so kind of go into where she started and where she's at now. So you can kind of see this is essentially where she started. This is the top teeth, and these are the bottom. Okay. And only after like 6 months of treatment, this is where she's at. I mean, that's an amazing change. And this couldn't be done with aligners like many years ago. But now that the technology is getting better, we're learning more. my wife and I take a lot of courses to make sure that we're up to date, because this is something that you don't really learn in school as much. But you can see this is a drastic change, a big difference for her in only 6 months, and she's told us it's changed her life. So that's like the most rewarding thing about what we do. Okay, this is the frontal view, so you can actually kind of see. So her bite is kind of off here. She has what we call a cross bite, where her bottom teeth are on the outside of the top teeth, and then this is that tooth that was really tucked back there. So you could almost not even see that she had a tooth there. It was really difficult to tell when you would talk to her. She was smiling, but if you kind of see the changes over time, we're able to kind of move those teeth into a much better position. And so again, this is kind of like the before and after. And as orthodontists, this is kind of what gets us excited. So like you can see this tooth was like, you couldn't even really see it there. And now it's like fully in line with all the other ones. Now, we still have a little bit of work to go. So this was just our first phase of treatment. So with aligners, we do multiple phases. So it's not just like a one and done type treatment. So at this point, I see a couple little things that I want to work on. Here, I want to kind of bring this tooth down a little bit, this tooth down a little bit here to close some of those gaps. These teeth are tipped a little bit, so I kind of want to tip those and straighten those out as well. So basically what we do at this point is we scan her again using the 3D scanner. And then I go back on the computer, plan the rest of the movements, and then we order more aligners. And so that's kind of where she's at. But after only 6 months, I mean, this is an amazing change. So that's pretty much what I have for you guys today. I'm happy to answer any questions. One of the best ways, if you have any questions, is to reach out to us directly. You can just message us on Instagram. I included the QR code, so it's easier to find there. But it's just at the Ortho Couple. So yeah, thank you so much for your time, guys. And I'd be happy to answer any questions now.
Absolutely. Well, thank you so much again, Dr. Cyrus, for joining us. It was really cool to see the simulations. Very cool to learn more about aligners. Speaking of which, we did have a question of it.
Mm-hmm.
So obviously outside of clear visibility of a patient's teeth, which is much of the incentive, I'm sure, for many patients having those aligners, what do aligners do better than braces?
Yeah, that's a fantastic question. So aligners have a lot of advantages over braces. I mean, the most obvious one is the aesthetics. I'll be honest with you, that doesn't matter to me, because at the end of the day, all I want is results and what's best for my patients. But that being said, aligners have significant advantages over braces. Now, with braces, for those of you who have had them, I'm sure you remember being told, I can't eat certain types of foods, nothing sticky, nothing crunchy, you can't chew gum. There's a lot of restrictions with braces. With aligners, you don't have any restrictions, So because you can take the aligners in and out, you can eat and drink whatever you want. You just have to remember to brush before you put them back in. So for those patients who, it may be difficult, giving up certain foods, or who don't want to have that inconvenience, aligners have a significant advantage there. Now, in addition to that, probably the biggest risk with braces is cavities. And that's because it's very difficult to brush and floss with braces. I'm sure many of you have seen people with braces and their gums are very puffy, they're very inflamed, they start to grow over the braces. What we tend to see is that patients, especially teenagers who aren't brushing well, they end up getting these white scars on their teeth. And really what those are pre-cavities. And so what ends up happening is, with the aligners, because you can take them in and out, it is significantly easier to brush and floss. With the braces, you have to use all those little special tools and instruments to go in between the wires, around the braces. And so realistically, if you wanted to floss your teeth, normally without any braces or anything, it might take you like 30 to 60 seconds. It's not too bad, right? But now with the braces on there, it might take you 10 minutes to properly floss each tooth, because you have to string it in between each wire, each tooth. And kids just aren't doing it. Most people are not doing that with braces, no matter how much we tell them to, no matter how much they say that, they're just not doing it. And so that's kind of where we see a lot of issue. With aligners, it's just like not having braces on there, because you take them out, you can floss normally, brush normally. So we really don't see any cavities with aligners. So for overall tooth health, the aligners have a significant advantage there, because really the biggest risk with braces is cavities.
And on the
Not to
flip
mention
side,
the fact that they're more comfortable too. So with braces, I mean, if you chew on something you're not supposed to, sometimes a brace will come loose, the wire will start poking your cheek. It's just a little bit more uncomfortable, like having the metal rubbing up against your cheeks. With the aligners, they're very smooth, very comfortable. Patients really don't ever complain about comfort. They tend to be a little bit more gentle on the teeth too. With braces, you got to come in, get tightened up. Sometimes it's pretty tight and you feel a little bit sore. With the aligners, it's typically a little bit easier, more comfortable treatment. So those are just some of the advantages. I mean, obviously it being more clear is great, and that's what patients want, but there's a lot of other advantages that are, I think, more important. Most importantly, the cavities portion. Yeah.
absolutely. Absolutely. And on the flip side of things, for the patients who have to have braces for one reason or another, are there things that braces do that aligners cannot?
So there's things that braces actually do better than aligners. Aligner treatment, we can do that on any patient that will wear the aligners. Okay, it's not easy sometimes. There are some patients who are a better fit for aligners, and there are some patients who are a better fit for braces. If we have to pull 4 teeth because there's too much crowding, sometimes, not always, but sometimes the braces can be more efficient with those treatments. That's not to say it can't be done with aligners. If it might take 18 months in braces, it might take 24 months in aligners. So it might be a little bit longer treatment. For those impacted canines, I still think braces are typically a better option. We can do it with aligners. We've done it before, but it is a little bit more involved. Whereas braces are kind of a set it and forget it type thing. All you really have to worry about with the braces is brushing well. With the aligners, you got to remember to be wearing them all the time. We've done even jaw surgery that used to only be able to done with braces. I've done jaw surgery case with aligners, and it turned out great. So you can really do anything with aligners. It's not easy though. I will tell you. You have to get a lot of extra training and do a lot of cases in order to feel comfortable with it. Going back to the physics and biomechanics. So we do a lot of thinking about how different forces are going to react with the teeth and everything like that. With braces, the forces are the exact opposite of with aligners. Braces are all pulling forces. So the wire pulls the braces and the teeth into position. With aligners, everything is a pushing force. So if you think about it this way, the forces and the biomechanics are flipped. And so it's a little bit more challenging sometimes to plan certain tooth movements, like a rotation, for example. That being said, if you know how to plan the movements in the proper way, which attachments to add, you can do it. It's just a matter of finding the patient that's going to wear it consistently. And then also, being able to plan those movements in the proper manner to get the achieved result. Yeah.
Earlier on, you were talking about your journey, being involved in, well, first of all, having a good DAT score, coursework, and being involved with community service. In terms of research, how much of a role does that play within the application process?
I think it helps. I personally don't like research that much. I mean, I'll just be honest. I think it's boring sometimes. I'm not really into it. I was more into community service. That would get me more excited, going and helping people and giving back. So I think you should do what you're passionate about. I will tell you, research definitely looks really good on a resume. Getting into dental school, it's probably not that important. Getting into orthodontics residency, it is more important. It's not absolutely necessary. I really didn't do much at all when I was in dental school. I did have to do a project when I was in ortho residency, but it wasn't too bad. So I don't think that it's something that is a must. It definitely will help boost your resume. If you're into it, awesome, good for you. Definitely do it, put it on your resume, but I don't think it's something that's absolutely necessary. I think you should focus on what you're passionate about, because that's going to come through. Anytime you're getting interviewed for something, I'm sure you guys can tell I'm very passionate about aligners and technology. And so being passionate about things is also just equally as important as having like a well-rounded resume.
Absolutely. And we like to introduce this question with really all our shadowing sessions,
Mhm.
because along the way, there's always students who catch an interest for one field or another during a shadowing session. So
Mhm.
it's helpful to know how can they get themselves involved, or at least have more exposure to orthodontics.
Absolutely. That's a great question. So that is something that is extremely important. I would recommend for everybody, even if they're not interested in orthodontics, whatever you're interested in, try and shadow in that field, because that's the only way you're really going to see what they do day in and day out. And if that's something you really want to do long term, whether you're doing medicine or dentistry or any field, it's a big investment, both time wise and financially, taking out those loans. And so you really want to make sure that that's something you want to do and that you would be happy with. I think the easiest ways, most people have had braces or aligners at some point in their life. If you have, then I would just ask your own orthodontist. Be like, hey, I had treatment a while back. I'm kind of interested in orthodontics. Would it be okay if I shadowed you for a day? Most orthodontists are very nice about that. They would be more than happy to let you shadow. Like I said, I shadowed in 5 different orthodontics offices. Nobody ever said no when I wanted to ask. Now, that was before COVID, obviously. So things might be a little bit more strict now, and they might be a little bit less willing. So don't get discouraged if somebody says, oh, no, we can't have someone in the office. I would just ask around. There are so many orthodontists everywhere, and most of them were exactly in your shoes, and they're happy to give back. Anytime we have someone that wants to shadow us, we're more than happy to let them. It's tough sometimes. We have to work it into our schedules, but we're more than happy to figure something out, because it's an important part of giving back and paying it forward. And most orthodontists are very friendly about that.
Absolutely. We also have a question about other specialties. So in terms of
Mhm.
being an orthodontist in practice, or maybe in residency, if this also applies, what other specialties did you work most closely with?
Yeah, so orthodontics, you definitely work most closely with pediatric dentists. So because they're most of the ones who are ready for braces or getting their teeth straightened when they're about 12, 13, 14. So I would say probably pediatric dentist. And that was also one of the reasons we worked when we were in Buffalo at a large pediatric group, because it was just a great collaboration. Anytime we needed something from them, they were right there. I was always working with another doctor. It was nice working with a different specialty, because they bring a lot to the table that I'm not as experienced with, and vice versa. I can help them with things that they don't feel comfortable with, and so it's just a great way to collaborate. And I think pediatric dentistry is probably the one we collaborated with the most. Oral surgery was also another one, and periodontics. They're kind of like the surgeons for dentistry. So anytime we needed a tooth pulled, or a impacted tooth needed to be taken out or something like that. But I think overall pediatric dentistry is probably the most common one.
And as a profession, just generally within dentistry, not specific
Mhm.
to orthodontics, how did you know it was a right career line for you?
Yeah, so I mean, I did a lot of shadowing. When I was in high school, I worked at an engineering firm. I shadowed an orthodontist. I shadowed a general dentist. I shadowed a lawyer. I did a bunch of different things. I saw what I liked and what I didn't like. And the place I felt the happiest and was the most excited to go to work was the orthodontics office. I mean, it was fun. It was like a busy environment. Everybody was happy there. We were always having a good time. I never felt like, oh my gosh, I've got to go in and do this again. Like it was always a good time. And, at some of the other jobs, I was sitting behind a desk all day, and that's just not my personality. I don't want to do that. I want to be out, like talking with people, moving around. And so orthodontics was great, because if you think about it, if you're seeing like 60, 70 patients a day, you're going to constantly be running around the office, and you're going to always be on your toes. You're always going to be doing something. For me, I really like problem solving. I think it's fun. And so the kind of that challenge of orthodontics, constantly having to like problem solve and think on the fly, was kind of what got me excited about it.
At what point did you decide orthodontics was your specialty?
Probably in high school. I kind of knew from then. I was like, wow, this is great. I really want to do this. I knew all throughout college. When I got to dental school, I actually really liked oral surgery. There was like a point in time where I was actually pretty close to like going for oral surgery, but I thought about it really hard and I was like, you know what? I love ortho. That's kind of what I originally wanted to do. And it has much better work-life balance. I think one of the best things about orthodontics is it gives you much more work-life balance than any other dental specialty. With oral surgery, it's awesome. It's a lot of fun. I mean, pulling teeth is like one of the most fun things to do. I know it sounds crazy, but like actually like getting in there and doing it and having that challenge is really great. But oral surgery is tough. You have to be on call, you have to be in the hospital. And one of the reasons I wanted to go into the dental field rather than medicine to begin with is so that I wouldn't have to be on call all the time. I have a lot of family members who are physicians, and they even told me, they were like, like dentistry might be a better choice, lifestyle wise, because you can own your own business. You're not going to be on call, tied to the hospital all the time. And in general, it just tends to be a little bit better work-life balance, which is important to me. I want to be able to, spend time with my wife and my future kids and, be able to like go to their games and things like that. So, orthodontics is a really great profession. It's not easy to get into, because it is such a great profession and has such good work-life balance and flexibility. But it's totally worth it. I definitely think it's worth all the hard years of sacrifice and everything like that to do it.
All right. Well, it's the end of the hour, or the end of this hour of the shadowing session today. So that will wrap up our session. I think that was a great point to land on. For our shadowers, I have a few last reminders. To earn credit for your attendance in viewing today, you must pass the quiz to receive a certificate. That quiz has a minimum passing rate of 60% or higher, 10 questions. So if you get 6 or higher, you'll receive your certificate. That quiz is now posted in the chat box. It's a Google form link, and it's also available on our website under the virtual shadowing page. Just click onto that and scroll down a little. You'll see shadowing quiz, Dr. Cyrus. Click onto that and you'll be able to access the quiz. The quiz will be due next week at 11:59 p.m. Central Standard Time on this upcoming Sunday, August 21st. After passing that quiz, like I said, you will receive a certificate. It will be specifically sent to the inbox of the email address you list on the quiz. Although if you don't find it there, feel free to check your spam folder or feel free to reach out to us. Again, our email is shadowing.h4h@gmail.com. And for our next shadowing session, again, we run on a Monday and Tuesday and Thursday schedule generally. Our next shadowing session will be this Thursday. We're actually going to have 2. It's going to be with Dr. Shaw from 6 to 7 p.m. Central and Dr. Lindquist from 7:30 to 8:30 p.m. Central to explore health policy and physician leadership. Dr. Shaw is actually the Secretary of Health for Washington State, so that's going to be a very interesting session. Again, this Thursday, August 18th. Like I said at the beginning, if you want to follow us for more shadowing sessions in general, feel free to follow us on Instagram or stay tuned over our listserv. Both are great ways, just over different platforms to stay in tune. And we'll see the same opportunities, the same flyers posted on those. So either way you go, it's roughly the same content that you'll see. But other than that, if you have any questions for Dr. Cyrus or his wife, feel free to follow them on Instagram, message them, DM them. But yeah,
please don't hesitate to reach out. No, it's a pleasure. Thank you for hosting this. I remember what it was like to be in your shoes and everything like that. So I'm always very open and honest and about I'll just tell you straight how it is. So if you have any questions about anything, don't hesitate to message us or anything.
Absolutely. And that's really appreciated, especially with the years of experience you have behind your back and passing it on to people who are get to see that in the future. It's really helpful.
Yeah. Stick with it. It's not easy, but it's definitely worth it. So
definitely. All right. Well, thank you again.